Hello, I'm Robert Hirsch, and I'm here as a citizen, as an educator, and as a concerned parent. As with most parents, I love my family dearly, and their well-being and safety are primary concerns in my life. Please stay with me for just a few minutes, because what I'm about to share literally concerns every American. It may be hard to watch, but it's vitally important information for you and for your family. Because of the nature of the material, please preview it before you share it with your children. Here and across the nation, Americans are struggling with the consequences of methamphetamine abuse. Every day we see those effects: identity theft, burglary, and crimes of violence, from simple assault to aggravated murder, in our newspapers, on television, and in our own neighborhoods. What we too often don't see is the effect on the children who live in the homes of methamphetamine abusers. In the past 2 years, Oregon's foster care program has seen an increase of 25% in the numbers of children taken from the homes of people who use methamphetamines. So many, in fact, that it's impossible to find qualified foster homes for all those children. Over the years, the single largest contributor to child abuse has been drug and alcohol abuse by parents or guardians. And here in Oregon, meth is by far the #1 factor in child abuse and neglect. In 2004, 95% of cases in which parental rights were terminated involved methamphetamine use. Any parent knows that even our own children can be trying on our nerves and challenge our patience. Meth users are especially susceptible. They're irritable and anxious, irrational, and paranoid. Dr. Jack Stump is an emergency room physician who is experienced in the effects of meth on children.
A man driving down the freeway calls 911 and says, there's somebody on the roof of my car. I'm doing 70 miles an hour and they won't get off the roof of my car. And they're trying to come in through my windshield, and they're out on the streets driving with you and I.
They're frequently disoriented and moved to violence. Often, children are the targets of their outbursts. Sometimes the victimization is psychological. Children witness aggression and violence among adults and directed toward their siblings. This repeated physical and psychological violence has long-term consequences for children. Studies of juvenile offenders show that 98% of incarcerated youths have seen or been involved in multiple traumatic events in their homes. Compared to homes without substance abuse, children in homes where parents abuse drugs or alcohol are 4 times more likely to be neglected and 3 times more likely to suffer physical or sexual abuse. Why and how have methamphetamines taken such a lethal hold on our society? And why have the effects of methamphetamine use been so devastating for children? Let's take a minute to look at how methamphetamines affect users. This illustration depicts the intersection of a typical pair of human nerve cells. One such substance, dopamine, is released whenever we experience a pleasurable sensation, like eating delicious food, making love, holding a gurgling baby, or watching a beautiful sunset. Methamphetamines disrupt and confuse the nervous system. One result is the production and release of much higher than normal amounts of dopamine. These graphs show the amounts of dopamine released in experimental animals in response to nicotine, morphine, and methamphetamine. The elevated levels of dopamine create feelings of increased energy and euphoria, and a sense of well-being. These sensations begin within a few minutes of taking methamphetamine, and depending on the amount taken, the effects can last as long as 24 hours. Methamphetamine quickly leads to a powerful addiction. For some users, it may be the first time they've ever experienced euphoria, the first time they've ever had a sense of well-being. Over time, with repeated use, the increased dopamine levels can damage the pleasure center of the brain, making it impossible for the user to experience any pleasure unless they are on meth. Only meth makes them feel good or even normal.
I used drugs in my teens: dope, acid, angel dust, and coke. I haven't used IV heroin. But I could quit, and I did. I hadn't used anything for 6 years. Then I tried crystal meth just once. It was better than heroin, better than cocaine, better than anything. Now I can't get it out of my mind. I'm thinking about it all the time. I've been in drug rehab twice before. As soon as I get out this time, I'm going back to crystal. It's just too strong.
Parents and grandparents, your children and grandchildren are vulnerable to the addictive potential of methamphetamines. Oregon's 8th graders are using illicit drugs at a rate twice the national average. Methamphetamines are readily available to your children for the price of a movie ticket. Your children may be asked to buy or try methamphetamines at school or in your neighborhood. One thing you can do is simply to pay attention. Outward signs of meth use include incessant talking, restlessness, loss of appetite, weight loss. Users may stay awake for days without sleeping.
And just the few times that I had managed to binge, my body had ate away a great deal of its mass. I still have yet to get back to where I originally was, and as far as a health state would go. It drives your whole body insane, pretty much. Every ounce of you is always looking for something to do. You're either mentally trying to find something to distract the other part of your body. You know, you stuff your hands in your pockets, maybe keep you from fidgeting a little too much. Try and cross your arms. Antsy, you're angry, you're just irritated, very paranoid, constantly paranoid. Constantly. Always looking over your shoulder. Meth has brought nothing but drama into my life.
The manic period of the meth high is followed by a crash, a prolonged period of unresponsive sleep lasting 1 to 3 days. Users withdrawing from the drug may suffer depression and experience suicidal thoughts. Then, to regain the high, they take more meth, and the cycle begins again. As meth use continues, the body is ravaged. Users' overall appearance, teeth, hair, and skin deteriorates. Meth users commonly appear to have aged prematurely. To make matters worse, methamphetamines can cause brain damage. This illustration depicts the areas of the brain damaged by meth use. Blue represents normal brain tissue, green and yellow depict slight damage, and red areas are most severely affected. Areas of the brain affected by meth use include those controlling emotion, reward, memory, and movement. Testing of current meth users demonstrates problems with verbal memory, inhibitions, problem solving, abstract thinking, and mental flexibility. Depending on duration of use and the quantities involved, meth-induced brain damage can last for years. Scans of the dopamine-rich areas of the brain demonstrate a marked decrease of dopamine metabolism with chronic meth use. Brain scans of former meth users abstinent for at least 14 months show the return of dopamine to normal levels. However, cognitive testing of the former meth users demonstrated persistent problems in several areas of brain function, including memory. We do not yet know if they will regain these functions.